Hello, hello, everybody. Welcome to another episode of Let Fear Bounce. I am Kim Lengling, your host, and I am so happy that you are deciding to spend just a small part of your day with myself today and my special guest, Dana Sherwin. She is a consultant, speaker, and longtime leader in healthcare. With over 35 years in the field, Donna's worked in hospitals, managed care plans, and major consulting firms, all with a passion for improving patient care and engagement. She's also a published writer, a volunteer advisor, and a voice in some of the top healthcare journals. Donna's all about making healthcare better for everyone. So let's dive into an inspiring conversation. Welcome, Donna. Welcome to Let Fear Bounce.
Thank you, Kim. So glad to be here.
Now, we were chit-chatting off mic before I hit that record button. Healthcare and questions to ask doctors, where you might find yourself if you are in a health scare or you're taking care of your parents. There's questions to ask. How do you navigate you've been in healthcare administration for years, for decades. What have you seen that's most prevalent that is the hardest for folks when they're first coming into this and they're going, "Oh my gosh, I'm overwhelmed. I don't know what to do or even where to turn first."
Yeah, well, that's probably at least 5 hours worth of discussion,
Yeah,
right?
I
So much,
know.
so complex. But let me just start with a lot happens before you get sick or before anybody gets sick. And having sort of the right doctors and knowing, what benefits you have under your insurance plan and sort of having, and one of the main things is having a primary care physician. So, you take good care of your children, you go to a pediatrician, you don't go to an adult doctor for your children. And so you have pediatricians, you have internal medicine, family medicine, you have primary care doctors, and for people like me who are over 65, they're geriatricians. And so in each category, the doctor is usually trained to understand sort of the age range and what is required for each patient. So it starts with, having a doctor that you can trust and rely on and that will listens to you and that you are able to have a voice with and express who you are. And part of it, a big, very big part of it is, you need to establish this relationship before you get sick, before anything's really wrong with you. Everybody should be having sort of baseline annual exams, checkups, whatever, have those discussions with your doctor, what's appropriate for your age. So it really starts there. It starts there so the doctor really gets to know you. And then we go into how do you actually approach each physician appointment? And let's just talk about that because I have I developed a 5-part framework for how people can communicate better with doctors. And I did this because I had a chronic illness that was very overwhelming for me, a complicated blood cancer disorder that I lived with for many years until my health crashed and I needed a stem cell transplant. And when I started feeling better, it really took a few years. I'm actually a 6-year survivor now of that stem cell transplant. But when I started to recover within the first few years, I started thinking, well, I know I'm not going to go back to my full-time executive level position in healthcare. What else could I do? What do I have to offer? What value? And it just was sort of a light bulb that, yeah, I spent 35 years on the administrative side in operations, sort of more non-clinical things, but all about giving people more access to healthcare and navigating the healthcare system. But what I realized was I didn't know that much about being a patient until I became a patient. And so I combined the two to come up with really, well, what's a pathway that people they find themselves in a difficult situation. It could be sort of a simple issue, but a lot of simple issues are very complex, like chronic diseases that people suffer with, throughout their entire lives. You have, diabetes or high blood pressure or cardiac issues that you're at high risk for or that you actually have and you need to be monitored. So really, whether you're well or newly sick or just with what might be a small issue or a more chronic issue or really an emergent issue, you need a way, people need a way to be able to um, cope. It's coping and using your brain. And that's why I sort of call my consulting firm the thinking patient. You need to use the abilities that you have to, yes, fear, anxiety, you hold everything there. But on the other hand, you really need a pathway to help you with action steps to move forward. So it lessens the anxiety and the fear.
Mhm.
I was in the system for all those years. I was so anxiety ridden. What's going to happen? Do I have the right doctors? Am I doing the right thing? What if I make a mistake? What if, and it was actually, I had my transplant and 6 months later it was COVID. So I really, didn't go anywhere for like 6 years because of my recovery.
Right.
So I figured that this is something nobody talks about. They don't teach you in school, in college, insurers don't teach you, employers don't teach you how you communicate with doctors for your health.
That is such a good point to bring up because I have a couple family members that are in their 80s now. They are experiencing some pretty decent health issues that have to be addressed and regularly addressed and taken care of. And I have found with them and with others, I was in the healthcare realm for about 6, 7 years working with seniors, and I found that the fear or anxiety overrides, and maybe their adult children don't know the right questions to ask. So what you're doing I think is awesome. And I'm always saying you've got to be your own advocate when it comes to your health. Because if you're not explaining exactly to the doctor what's going on, they're going to assume that you understand what they're saying about your condition. And if you don't, I mean, I'm always saying ask more questions. Write them down on a tablet before you even go to your appointment. I personally do that for my own self because if it's just me going, I had a lung issue and I had to have lung surgery. And all of a sudden, I was filled with anxiety, like you were saying with your own self. And I remember I wrote questions down in a tablet and took them with me to my appointments because you become so overwhelmed. And you said you have a 5 point
5-part framework.
5 part framework to help folks with that. So can you share some of that?
Sure. So the first one I started to talk about, and that's really preparation. You make your doctor's appointments in advance. I mean, obviously, if you have an urgent condition, you go to an urgent center, emergent condition, you go to an emergency room. But if you have a planned doctor's appointment, whether it's a doctor that you've met before or not met before, it's important to convey certain information, but to plan it in advance because the appointments are very short. Some people told me, people that I talk to across the country, they tell me that they have 10-minute appointments. And that blows my mind. I mean, I know it is 15, 20-minute appointments here where I live in New York. But so you need to come in with a plan because what are your priorities? What do you want to accomplish during this appointment? It's very important. So you write that down as part of it. And then in advance of the appointment, whether it could be months, could be weeks, you start keeping notes on questions that come to mind or things that you're researching that you want to remember to ask the doctor. Because the worst thing, and doctors really do not like this at all, and it's very sort of off-putting to everybody. They call it, there's a technical term, hand on the doorknob questions. And that is when the appointment is finished and the doctor has his or her hand on the door. Oh, but doctor, one more question,
Yeah.
right? This is not a good situation because you're probably not going to get really a thorough answer anyway. But so planning in advance of your priorities, your agenda, your questions, some research you might have done, follow-ups from other doctors you want to bring to this doctor's attention, or really a summary of your medical history, and also really expressing who you are. This is who I am. I like to be involved in my care. I like to take care of myself. I want to know. It makes me feel better. Or this has been my past experience. And so, yeah, I'm a little nervous about this and this because my mother passed away and her from breast cancer and her sister did. So these are the things on my mind. The more that a doctor knows about you, the more the doctor will understand and be able to evaluate you better. So that's sort of the preparation phase. The next phase, and it doesn't go like one after the other. When I really depict this, it's like in a pie chart. In a pie chart. So all the ends really touch each other, and it doesn't necessarily go in order, but I tried to put it so that it makes sense for people to remember. The second is I call it language, sort of knowing the language of your health, how to pronounce your diagnosis, what your diagnosis means. how to pronounce your medications. It blows my mind that people cannot pronounce the names of their medications because in most visits, the doctor or a nurse is going through all your medications with you. And you want to like go through that pretty quickly. And you want to be able to say yes, no, well, a lot of offices tell patients bring in all your medications so they can just look at it and they don't have to rely on patients. When I take 15 different medications and I took 20 post transplant, but now I'm like down to 15 medications. And so I know it like the back of my hand because if I get a new medication, I want to say, oh, does this new medication interact with anything else?
Right.
So that's why the language and look, there are all kinds of levels of health literacy. Some people have the capacity to understand more than other people. Some people have had more experience. Some people have had more interest in understanding, medical conditions. But whatever your level is, your level of ability, you could always do a little bit more and a little bit more. And I talk about that later because it's really important. It's okay. A little bit of understanding, be curious. I mean, one of my pet peeves is when people say, oh, yeah, they say some word and they say, I don't really know how to pronounce it. Well, if you're going to be publicly saying that word, there's all these ways you could Google something and then press the voice and it'll tell you how to pronounce a word. So it's part of, at least part of my mindset.
Yeah.
You want clarity and you want the other party, look, whether it's a doctor or somebody else you're looking to communicate with, you want the other party to know that you're serious, you're focused, you want to understand. So those are really key things. So that kind of language thing is important. When I before my diagnosis, I was feeling a lot of pain and I had such trouble describing the pain that I was feeling. It was like I called like flu-like symptoms, my bones hurt, and I just couldn't. I couldn't express it. I would just say it in that way. Well, while I was doing my research for this work that I'm doing now, I found that there were these researchers up in Canada, McGill University, that came up with a whole methodology for the description of pain. They came up, I think it's 72 words that
Oh,
describe pain. And I thought to myself, boy, gee, I wish I had that when I was going through this pain. Because what do people usually see on the walls in the doctors? Those smiley faces. And if I see another smiley face, I'm just going to rip it off the wall.
no.
And I'm sure anybody who has been in any chronic pain just wants to rip those faces off the wall.
Yes.
You want to
Yeah.
describe your pain. Yeah, it's worse than last time I was here, fine, but it's like it's a stabbing, it's sharp pain, it's this pain, it's that pain. And I never had that language. And that language of pain is like a codified system. And doctors don't share that. Who's sharing that with people? So, I mean, I found it, and the information is out there, but it's so distributed, it's so diffuse. You could Google something, but it's like a needle in a haystack. You sort of have to know what you're looking for. And
Right.
how many people, when they're feeling pain, are going to go on Google Scholar and say, share with me all the research articles on how do people describe their pain. I mean, people don't do that.
No.
But this was an opportunity for me to like create more body of knowledge and structure for people because I felt like words help. Learning how to express yourself helps. And this is where I thought that I could provide, more value. So that's language. The third, we've sort of touched upon questions. So the third part of the framework is questions. And one is being prepared with questions in advance. But like you said, you refer to the fact that when you ask a question, it's an opportunity for the doctor to understand what you know from what you don't know. Very important, what you know from, and it helps you too. And even if you think you know the answer, you should ask the question because maybe you're wrong. I mean, I do all this research now. I mean, I was not a science major student or anything. I didn't go on to the clinical side of healthcare administration. So I do struggle, but I'm very, obviously I have a personal reason for wanting to do better and learn all about this stuff. Um, but but so when I research something and I go tell the doctor, look, I found this, and this, it seems like this, and 9 times out of 10, I'm wrong in my interpretation. But if I didn't ask the question, I wouldn't really know. I would think
Right.
I could learn whatever I need on my own. I could be my own doctor. It's not the case. You can't do it. Even doctors go to other doctors
Right.
for their
Yes.
health care.
My doctor, I had a lung issue, and my pulmonologist consulted with three other doctors on a
Wonderful.
regular basis because mine was a little different,
Mhm.
and it wasn't presenting as cancer, but they couldn't confirm what it was, why it showed up where it is. So he regularly consulted with this team and he called it his team. He goes,
Wonderful.
the four of us, we regularly consult on patients
Mhm.
because we want all of the knowledge that we can bring in so we can give the patient the best outlook, the best advice, the best information that they're able to gather. So, and I was very fortunate that way that I have a doctor that does that and that actually listens.
No, that is wonderful. And when you go to a clinic or a doctor practice that's part of an academic medical center, they're usually practices that involve other doctors of the same specialty, and they act as that team. So you get that benefit. But it's just wonderful to hear that was the case for you. What
Yeah,
a
so it
great.
is out there, folks.
Yes, yes. So I wanted to say something else about questions. So there's a technical term called question prompts. And question prompts, something that's been studied by healthcare researchers. Can we make patients better patients by giving them questions in advance to ask their doctor? Because then they'll have more knowledge going in and understand what they need to know from the doctor. And they did these studies, and first they gave people 22 questions. And then oh, wow, that really worked. People were more engaged in their care. Then they said, okay, maybe we could narrow it down. And they came out with 14 questions. And that worked. Oh, maybe we could narrow it down even more. And then they came up with 3 questions and they said, this covers a lot of ground, these 3 questions. So I want to share these questions with your audience and
Okay.
have them in the research that I've done. So the first question is, what are my options, including the wait and watch option? So doctor tells you a diagnosis, you want to, what are my options? What are my options? And what if I wait and see and we just monitor? Second is, what are the possible benefits and harms of each of those options? And the third is, how likely are each of these benefits and harms to happen to me, including what will happen if I do nothing? And so if you have not, if you didn't do any research and you just go in cold, that these are 3 very important questions to ask. However, if you're going to see a specialist, really, all you had, let's just say everybody should have a dermatological full body skin exam every year. I mean, I think no, most people don't dispute that. You can Google, I'm seeing my dermatologist for the first time. What are the questions I should be asking my dermatologist? And and also all the time, it's what else should I be looking for? What else should I be thinking about taking care of myself? I mean, so there are questions that you can research, not only Googling or through AI, and that's a really good way to do it. But for the large disease categories, they all have, associations and research foundations,
Right.
and you can find questions on those sites. Amazing. My disease community was the Myeloproliferative Disease Foundation. They were an amazing source of information for me, understanding the disease progression, drugs, clinical trials, doctors who are top in their field doing both practice and research. It's just an amazing source of information for people who are newly diagnosed with, a cancer, a complicated disease, diabetes, a cardiac disease, gastroenterology category of disease. These are the biggest chronic diseases that are happening in our country today for a whole variety of reasons, which, I trying to pay attention to because it's about the message. It's for people with chronic diseases, but it's also for people for prevention programs, health promotion and health prevention. So that's why, well, what is the audience that I want to get my message out to? It's really people. When I was in my 20s and 30s, I didn't pay enough attention to my health. I
Yep.
found out about my condition because I had symptoms I needed to take care of right away because I was in pain. That's how I found out. That's how I was diagnosed, even though it was an underlying genetic condition. There's genetic testing. There's evaluation of your risks. A lot of employers provide health assessments, free health assessments for people. So taking advantage of these opportunities to participate and understand your own health better because every individual is different. And particularly for complex diseases, I once asked my hematologist, where do I, when I was newly diagnosed, well, where do I stand? Am I at a low level, medium, high? Where am I on this disease spectrum? He says, well, every patient, if you've met one patient, you've met one patient. That's it. Everybody is different.
Right.
Everybody's progress will be a little bit different. And so you want to be able to take care of yourself to the best of your ability and to the best that medical care and preventive care and lifestyle kinds of interventions will be helpful to you. So that's the question part. I think there's a lot of information available, but when people are in a panic, they don't stop.
Right.
But really, when you're preparing for appointments, this is the time to stop and say, okay, let me get more knowledgeable. And I'm not saying, drive yourself crazy in terms of doctors call it Dr. Google, like
Yeah.
you bring Dr.
Yeah.
Google to them.
They don't like to hear that you Googled.
Right. And they don't want really a whole file. They don't want a patient coming
Right.
in. Here's a file. This is all the research I've done. Because most doctors are pretty experienced. Like even after doctor goes to medical school for 4 years, then they do a residency for 3 years. And then let's say you go to a board certified doctor, they've done a fellowship and some have done more than one fellowship or more than one residency. And so they come to the equation like maybe in their mid 30s that they have like almost 15 years of experience in the field. And the doctors that, do the residency programs are doing it at major academic medical centers where there's a lot of action and a
Yeah.
lot of different diseases being presented. So they do learn a lot. They do learn a lot. So
My
that's,
my niece just became a doctor. And so she just started her residency. And so learning from her and her sharing her stories of going through college and then, the medical school and all the different they had to practice for so many months in one is in geriatrics, one was in peds, one, in infection disease. So they had to do rounds in all of these for months at a time. And it was just amazing what she was learning during that year of school, where, those couple years of school where it was so many months here, so many months here, so many months in this hospital. And it was just amazing what a doctor's going through. And like you just said, by the time they're in their mid 30s, they have years and years of experience under their belt already with a lot of different things, much more than what we realize, I think, because we're not in that realm, you know?
yes, and as you get older, you maybe are not so happy getting a younger doctor. But my experience with my disease, because I never wanted to see doctors who were that much younger than me, but in my experience with my disease, the doctors that participate in hematology, oncology, or all these, I see a cardiologist who specializes in oncology, all these people, they're so dedicated
Yeah,
to helping people and they're fascinated by the field. And that's the kind of, and you can tell by how they relate to you and what they try to draw out of you. But there's
right,
just not enough time in a 15, 20-minute visit for a doctor to do really health education
right,
or to really understand you from top to bottom, to draw it out of you. You have to be prepared to have that interaction and be a partner. And that's where we come like to the fourth area is really the participation, being ready to participate. So when you're prepared and you have questions, it allows you then to freeze your mind. You're all prepared. It frees your mind to have a direct interaction with the doctor, understanding that how an appointment goes, what the different parts of a medical visit are. It's called the medical interview that the doctor does because they do have to obtain information from you and they do have to do what's called a differential diagnosis, meaning like a lot of ruling out, it could be this, it could be that, what should we do? And then the third part of that is then they talk to you about the potential of what the either a treatment plan or a monitoring plan or a follow-up test and where that's all going to lead. And as you can imagine, that alone could take the 15 minutes
right.
separate from you sharing all your medical history, or maybe you saw six doctors in the 6 months before you saw that, and you want to tell the doctor, I did this, this is what they found, I did that, or at least just bring copies of medical records if they don't share the same system of the previous doctors, which in my case, I go to two big systems, and I have to physically bring
Yeah.
records from, because they don't use the same electronic medical record. So I
Yeah.
have to be, I call it like the CEO of my own health. I have to be the one coordinating all of this and handing it to them, but it's to my advantage. And when doctors see you're prepared to have that discussion and that you ask good questions and that you really want to do shared decision making with them, they respond very
Yeah.
enthusiastically to a patient who truly, sincerely is their authentic self, trying to do the best that they can with something that's extremely distressing for them. I mean, you know, I don't know anybody who doesn't walk into a doctor's office with a little bit of worry. What are they
Right.
going to?
Exactly. Yeah. You're going to carry that. You're going to carry it with you. I know I have, with several things that I've had to go into the doctor for, and you're like, I just don't, I can't, this is what's been going on, and I need to find out what it is. Why is this happening to me? Why do I feel like this for so long?
Right.
So that's pretty scary. It can be because your own brain has been going overtime, and maybe you have been looking up stuff, and like you had said, you had all this information and you found out that the bulk of it was wrong that you had looked up. So that's also scary. So don't rely on Google, but it's an awful good place to find some information to help you along. I agree with that. So
Absolutely.
what is number five
So
then?
number five, I really came to the conclusion that one of the most important parts of this whole process and really a pathway for people to follow is courage and having the courage to be able to do that. And so the courage gives you confidence and, for you just start with everything bottled up so much inside of you that you can't possibly think I need to be courageous about it. But when you take small action steps, you start building that courage and you build that courage and you build that courage and you get good feedback or you make progress or you feel like you're doing the best you can. It just helps you build that ability to be courageous about taking care of yourself because it's so important and you want to do the best you can and, feel good so you could go back about your life. I mean, it's something, look, it's like going to the dentist. No one wants to go to the dentist. Nobody wants to go to the doctor. Well, you want to take care of your health. I mean, people will spend more time try figuring out what new car they want to buy with spreadsheets and dealers and should I get a hybrid, should I get an all electric, should I well, what's my dream car, and let me look at all of them, and they spend more time on us with a spreadsheet detailing all of that when that same effort could be put into their own health and taking care of their own health. So the courage thing is everybody has courage inside of them. It's about developing the courage in relationship to having to face some very difficult, challenging kinds of things in your life. And even if there is nothing wrong with you, when you age, your body normally will need certain monitoring and
Right.
things happening because there's a very high percentage, maybe it's 60 or 70% of the population that is at risk for certain genetic disorders, just the way that is.
Yeah.
And so you do need to, dig down and find that courage. I don't think that I know anyone who's naturally, I climb this mountain, but yet it's hard to be courageous about your health, or even, if you're taking care of your parents or your own children. If something's wrong, you're just like a ball of nerves, and you have to find a way so you could keep doing the right thing to take care of your health or the health of a loved one.
And it can be, well, when we both know it can be incredibly overwhelming. If you have a support system, friends, family, clergy, what have you, that's also incredibly helpful. Take one of those people along with you to one of your appointments, maybe the first one or two if you're overwhelmed, or if you know it's going to be a big appointment. And for me, I know that there are certain appointments that I go to, and I ask my sister to please come with me because I know my brain probably within 5 minutes is going to go, done. Just, it's too overwhelming. The fear's kicking in. And sometimes the courage, it's like, okay, well, I have it. And then, oh, where to go. So to me, anyway, I've often shared with others, if you have someone, take them with you. So they second set of ears, because you might not hear 100% of what the doctor tells you either, even if you're writing it down. I know I've taken notes before on my own, and I come home and I look at my tablet and I'll be like, I don't even know what I meant on that note that I wrote down. But yeah, I love the information that you shared, because it's just so practical, and something I think that everybody should, hopefully, hey, go back and re-listen to this and write it down 1 through 5, and then add your own comments in there. Because like you have said the whole time, everybody's different. Your situation's different. Maybe you don't have anybody to take with you to appointments. So yeah, this is what a helpful pathway, that you've given. Very, I think, timely. And you had mentioned as we age, you run into more health issues or things that you have to be more aware of regarding your health. So for those of you that are of a certain, I always say of a certain season, because I'm of a certain season now. That and you're all of a sudden you're going, what's my body doing now? Why is it doing that? So it's always good to be prepared and be aware. you know Listen to your body, because it's only you who can share what your body's doing and what your body's trying to tell you when you go into the doctor. So listen to your body, make those notes, use the 5 things that Dana just shared with everybody. Oh my gosh, what amazing information. Thank you so much for sharing all of that and for being my guest today. This has been, time goes so fast, and I know that there's a lot more we could talk about. But where can people find you? And if you have anything that's available out there online?
Okay, so I write sort of in a blog kind of format on LinkedIn, so people could find me, Dana E. Sherwin, on LinkedIn. And every week I pick a different subject that I do research on and I share, and it's all about empowering patients to communicate better with doctors and be engaged in their care, and that's sort of the focus. So you can find me there. You can send me a message if you need any other information, or you want to learn more, or if you think there's a topic that I haven't covered that you're interested in. I'd love to know.
How awesome that you do a weekly themed column on this whole topic. That's awesome. Yeah, folks, definitely check that out on LinkedIn, correct?
Yes.
Under your name, Dana E. Sherwin. And that'll be in the show notes, folks. So you'll be able to, I'll put the link in there so you'll be able to have access to that and check out what she's written and what she's writing in the future. Now, Dana, I ask all of my guests as we round out the show to please toss out a nugget of hope to the listeners, something that they can tuck away and carry with them. So, what would your nugget of hope be today?
Focus on your health every day will give you more quality of life and more joy, and allow you to be the best person that you can be in your life, and to be there for others as well.
I love that. Focus. What a good one. Good nugget. Thank you very much for sharing that. And thank you once again for being my guest today. This has been an awesome conversation and so very insightful. I know I learned a lot, and I hope all of you out there listening learned. So Dana, I'm sorry. Thank you so much for being my guest today.
Thank you, Kim. Pleasure meeting you.
And everybody out there listening, thank you once again for tuning in. Each Wednesday, folks, new episodes are uploaded on YouTube as well as Spotify and all your favorite listening platforms. Be sure you tune in, listen, rate, like, share, do all the things so we can keep these nuggets of hope and these amazing messages shooting out there across the globe. This is Kim Lengling, your host of Let Fear Bounce. Everybody be well, stay well, and above all, be blessed.
Kindness. It's simple, powerful, and free. Yet, it holds the extraordinary ability to change someone's day or even their life. Order your copy of Nuggets of Hope, Cultivate Kindness on Amazon.
Thanks for tuning in to another episode of Let Fear Bounce. New episodes drop each week, folks, on YouTube and Spotify and most listening platforms. So don't forget to like, subscribe, and do all the things. So until next time, folks, take a deep breath, be kind to yourself, and as always, let fear bounce.